Hi everyone, my name is Dr. Indra and it's lovely to see some old faces and some new faces here today. Today our webinar is going to be led by Ruth Tarr, our integrative psychotherapist, and Cori, she's a nutritional therapist, but integrative nutritional therapist as well, and myself. And we are going to be talking about functional medicine for children and adolescents. So first of all, a few sort of housekeeping. So just so that everybody's aware, we're not providing any medical advice. We're talking around different issues. If anything comes up that you think, oh, that might be useful for you to use or advise people or implement this for a child that you may know, then please make sure that you are working with someone or have the knowledge and the ability to know that this is okay for that person. Please mute your microphones, and after the presentation, as I said, there will be time for you to ask us questions. And if you do want to work with us, then do book in a discovery call with our team here today. So, my name is Dr. Indra. I started this practice 8 years ago with the passion and understanding that we are whole and not broken, and we have the ability to heal. I came from a background of being a general practitioner, and therefore I have looked after from 0 to 100 and even older than that. And I realized while I was working as a general practitioner that there was something missing in the way that I was practicing as a GP. I felt like I was not able to have enough time or be able to see the whole picture as to what was going on with our patients. I then came across functional medicine, and this way of working basically opened up my heart, and I realized that this is what I was meant to do as part of my service to humanity. I needed to find a way to practice this, and I was not able to do this in the NHS. I did little bits of it, started working with an understanding of how our body is meant to heal and the things that we can do to support healing. As a result of that, I knew that I wanted to have a multidisciplinary team to support me. We call ourselves a collaborative care team because we collaborate even down to our patient care team who are here with us today, because all of us are involved in supporting our patients so that their journey is as smooth as it possibly can be and as supported as it possibly can be. So I'm now going to hand you over to Ruth, and she's going to start our little presentation.
Thanks, Indra. Thank you all for being here. You able to put that slide up for me?
Yeah. Did you want to introduce yourself and Cori first?
Oh, I can do. Sorry. I'm Ruth. I'm the integrative psychotherapist at the practice. And very much like Indra, felt that as a standalone practitioner, there was only so much I was able to achieve for my patients. Whilst I look at the psychological side of things, I felt like there was something missing from them healing and being the best version of themselves that they could be. And when I got introduced to functional medicine and worked on my own health that way, on my family's health that way, it quickly became apparent just how powerful this way of working can be. How this understanding that you are not separate symptoms and it is not your separate systems we are looking at the whole of you. And very much like Indra, it's not my job to fix you because you're not broken, even if mentally you feel that way, but it's about bringing you back to your own inner health and well-being. Cori, would you like to introduce yourself now?
Hi everyone, I'm Cori Flynn. I'm the nutritional therapist at the Dr. Indra Clinic, and equally, as both Indra and Ruth have said, I love working as part of a team. It means that we can look at people from various different points of view and really look at that person as a whole, and work together to provide sort of the best service that we can for that person, and really show some care. I guess there's a lot of care in our practice, and making sure that people are really supported along the way, to make any changes that we would suggest. I'm also a mother of 2 young children, And I have also, in the previous life, worked as a cookery teacher at a specialist college. So I worked a lot with various young people with challenging behaviour and learning difficulties, and supported them to actually become quite familiar with food and to eat a more varied diet. And it was actually that experience that led me to then train as a nutritional therapist, so that I could actually have some evidence behind what I was suggesting to people.
I love that. Thank you, Cori. Indra, you can put that slide in. Yeah. Okay, so what we're doing with this talk is we're going to introduce a fictional patient that's been working with their normal GP. It's an 11-year-old who's presenting with eczema. And of course, what we know about eczema, there's a lot of itching, bleeding skin, and just distress all around. And the GP's suggestion has been topical corticosteroids, so just putting things on the skin, and the emollients as well. And it doesn't seem to be working, or it's keeping the symptoms sort of down, but it's not stopping the eczema itself. And as parents, we often feel concerned when our kids are distressed, when things don't seem to be getting better. And here we have a parent who is concerned with that. They're worried about the overuse of steroids. They're worried that it doesn't seem to be having that desired effect for their child. The GP is saying, actually, these are the only options we've got. Their child is getting more and more distressed. Not only is it the itching and the bleeding, but it's also now impacting on how they view themselves, because it's affecting how they look. And so the parent is looking for an alternative. They're searching out there, and they come across a functional medicine practice like ours. So they approach us and they're saying, well, what can you do? So they book a complimentary discovery call, and they find out, actually, there are other things that we can do. Then they move to sort of, we take very detailed information from them at the pre-consultation stage using questionnaires. And then in the initial consultation, this is sort of where things start coming together, and actually the parent and the child feel like someone is really listening to their story. They're really listening and understanding that level of distress. And so what we're looking at when we're in that sort of information gathering stage is we want to really get to know our patient. We want to know about their whole life. We want to know what enjoyment they have in their life, what things are distressing them. We want to know about their sleep. We want to know about how they're moving and the activities they're doing. We want to understand their nutrition and where they're at. We want to know about their state of mind, so their mental health, their thoughts, their beliefs. We want to also know what community they're involved in, who's that lovely supportive network around them. And all of these things sort of may sound a bit strange if you've been dealing with your normal NHS GP. But what we want to do today as part of this talk is to explain why some of these things are so important in the functional medicine that we are practicing. So when we delve deeper, when we begin to unpick that life story, we're not just interested in the child's life story. We actually want to know what's been going on even before they've been born. Are there any things going on in the family that we need to be aware of? And in this case, this 11-year-old with eczema, we find out that the mum actually has some food intolerances. We then move into the child's life story, and we will put it in a timeline, but all the information comes out in the questionnaires and the consultation. So we find out that the child's actually been on antibiotics from birth quite a few times for recurrent ear infections. About 5 years old, those dry patches started to appear. Well, they've never liked vegetables, so they don't eat them. And delving deeper into that sort of distress. So yes, they've got itching and bleeding skin, and they're worried about how they look. But actually, when we unpick it a bit more and dive a bit deeper, we find that their skin feels irritated with other things, so like fabrics. Their life itself, their sense of community and self-worth has almost diminished because of how they look. They're no longer interacting with their peers in the same way because their self-confidence has plummeted. They're too self-conscious. They used to love swimming. That was one of their favorite activities and it brought them so much joy, but they don't do it anymore because they don't like the way they look. They think everyone's looking at them. It distresses them. The chlorine irritates their skin. Then we're looking at their sleep. Well, they're itchy, they're irritated, they're not sleeping so well, but it's more than that. It's more than that skin irritation. Their mental health or their state of mind has dropped. So their low mood and their anger and irritability are all feeding into them not sleeping properly as well. And they're sort of beginning to isolate themselves. They're not socially engaging with their peers and their friends anymore because of their low mood, because of how self-conscious they're feeling. Indra, can you put that slide up, please?
Yeah.
Thank you.
Oops.
We're having a technical difficulty.
Technical difficulties, okay.
So as a parent, you may then be thinking, hold on a minute, I've come to you because my kid has eczema. Why are you asking about sleep and community and movement? That's not something the GP asked me. So Indra.
So with the history that we have taken, history is the key to understanding what's happening in a patient's life. When we can understand all of those symptoms and all of the things that have happened to this 11-year-old coming to this point in their life, we start to make connections. And connections is key to understanding this word called root cause. We start using root cause a lot in functional medicine. And we kind of wonder, well, what does that actually mean? Why do we need to have root cause in what we're doing? Because when you understand how and why your body is working the way it's working and what's contributing to the way that the body is working, we then start to understand why the symptoms are present. Because the symptoms, I feel, are like love letters from our body. Somebody else used that word, and I absolutely love that way of describing symptoms. It's the imbalances that are expressed as symptoms, and they're signposts for us to understand what's happening internally. So let's take sleep. Sleep could be both an external factor and an internal factor. How is that connected to what's going on in the gut? If they're not sleeping, are they not resting? Are they feeling more anxious because of that? Is that then affecting the vagus nerve, which is partly of how it's part of the body and how it responds to the world around us? Is that then affecting the gut? Is that then changing the gut bacteria balance? Is that then creating these products that are affecting how the skin is expressing itself? Because one of the key things we find in functional medicine is inflammation is the key to a lot of chronic issues. And inflammation, the way I describe it, and I'll get both Cori and Ruth to say their definition, but I describe it as like the fire that's happening within us. And the fire will have to show itself up. And that may come out in your skin, it may come out in your gut, it may come out in your mood, it may come out in your behavior. We see that with kids with ADHD, different behavioral problems. It may come out in joint problems. It could come out in any different way possible. So for us as a team, my role in this team is to make those connections, understand the history as detailed as I possibly can, so that we can start to make the connections and start to then figure out what kind of testing and what are the next steps for this young person moving forward.
You're okay to show the next slide, please, for Cori.
I'm just going to see if this works. Right. So we hand you over to Cori.
Yeah, so when we're talking about connections, we're thinking, like Indra said, about taking the story and understanding what's going on. And one of the things that I like to talk about, food, but also actually poo. So and kids love poo, so it's a nice conversation to have. And poo gives us such an insight into what is going on in the gut. And Indra just mentioned about sleep and the connection between sleep and the gut. And in eczema, we are really thinking about the association with what is going on in the digestive system. There are multiple factors, as with anything. Everyone is an individual, so what might be sort of contributing to one person's symptoms isn't necessarily contributing to the next person's symptoms. But in naturopathic nutrition, as a general thought, we are really thinking about the digestive system and the connection between the brain and the gut, and what might be contributing to eczema. And you may have heard the term leaky gut. Actually, it's not used as widely as it was for a while, or gut permeability. And that essentially means that the cells in your gut lining should be really tightly packed together. And when we eat food, these move apart and allow the particles, the broken down particles from your food and the bits, the nutrients and the things that we want from the food to move through and be absorbed into the blood. And then they should tightly pack together again. Now, in cases of things like inflammation, which we think of as being, as Indra said, sort of a seat to chronic health, also, if there's some food intolerances, that is really aggravating the gut. And these tight junctions, these cells being tightly packed together, move apart, they move further away, and they move away for longer. And then they then allow bigger proteins than should to move into the blood. And then your body says, whoa, hang on a second, what's that doing in my blood? I need to mount an immune response because that shouldn't be there. And then you get an immune reaction. And eczema is one of those immune reactions that might show up. So poo, looking at poo, might give us an idea about some digestive issues, especially in younger kids that aren't able to totally verbalize what's going on for them. It's really a helpful tool for us to use. You know, if there's some undigested food in their stool, then we know, okay, things aren't being broken down quickly enough or properly enough, and therefore they're coming out in the poo. So yeah, that is a great one for us to think about. And I think my top tip, so then we're thinking, okay, how are we going to really support that environment and make that environment really strong and integral? We've got a mucous membrane, so a mucilaginous mucousy membrane covering the whole of the digestive tract, and that's really important for that barrier function. There are immune cells within that, and we're thinking, okay, how are we going to look after that? And I think probably my top tip actually for looking after that, especially with children, and most children are quite up for eating this, is stewed apple. So stewing apples, actually using eating apples rather than cooking apples, because they're naturally sweeter, so you haven't got to add any additional sugar or honey. And keeping the skin on, so really finely chopping them and stewing them just with the tablespoon of water to get it going, stewing that right down and eating that. There's a lot of pectin just under the skin in that apple, and that is going to really support that mucous membrane.
It's quite interesting, Cori. There was a research paper that I think was shared with me right at the beginning of my journey, and it showed that if you eat 2 apples a day, which is quite a bit, stewed apples a day for 2 weeks, it completely changes your microbiome. It's unbelievable, isn't it?
Yeah, an apple a day keeps the doctor away, isn't that? That's the saying.
Right.
Next slide, please.
Thanks. So again, we're going to look now at, you know, your GP hasn't really asked about your kid's state of mind apart from, oh yeah, they're distressed. No, I'm not surprised by that, because they're, you know, they're itchy, they're bleeding, they're a bit self-conscious. But actually we want to go deeper with that. And remember, we're considering your whole child, their whole life. We're looking at all the aspects of their life that are perhaps changed, shrunk, that they're fearful of now, or that they're veering towards, and sort of really engaging with them to try and understand what is it that they would love to happen. You know, how would they love their life to be? And you know, with an 11-year-old, you might hear something like, well, I'll never get better. This is just now how it's going to be forever. And it's working with that mindset and offering them different strategies and tools and techniques that will help them move forward and change that state of mind. And the reason we're looking at state of mind as well when we're talking about eczema is because we've got the brain skin axis, and we know that if we get stressed, we can get eczema flares. And so we are working with that side of that system, as well as supporting the nutrition, as well as looking at the community and the sleep. But one thing that we also do, and I think this is a really unique thing, and I think it's incredibly important when we're working with children and young people, is that we are also here to support you as parents. Because let's be honest, it's a lonely journey sometimes. And we don't always know if we're doing the right thing, saying the right thing. And it can be incredibly stressful for us as well. And so we also want to know, with this 11-year-old, okay, how has it impacted family life? Is everyone stressed? You know, we might even find out that the whole family are no longer swimming and it was something they all loved doing. The parents might feel at the mercy of the 11-year-old's moods, because some days they're willing to do things and other days they're not. And so they almost feel like they're being controlled and manipulated by their 11-year-old who is just struggling. And we are there as a practice, as a collaborative care team, to support that part of the journey too, because as parents, we are that safe space, that anchor for our children. And so if we're not feeling okay and we're not handling things okay, we sort of can't expect our kids to either. So we're there to support you in a coaching capacity as well. And then Cori, will you talk a little bit about the impact of stress on digestion, please?
Yeah, sure. So I guess it's really important to say that you could have the best diet ever, but if you're not digesting it properly, you won't be able to absorb the nutrients that you need out of that food. And those nutrients are needed for all the different systems in the body. And when we think about the nervous system, we can think about it very simply in two branches. So we've got rest and digest and fight or flight. So fight or flight is our sympathetic nervous system, and rest and digest is our parasympathetic nervous system. Now, fight or flight is a very old mechanism that we have, which is previously there would have been a lot more wild animals around. And if you saw a wild animal, your fight or flight response would have been activated. And in that state, your body is not interested in digesting food. It is not interested in your immune system functioning properly. It's not interested in your reproductive system functioning properly. All it is worried about is getting away from that wild animal. So it's going to pump a lot of adrenaline and cortisol around your body to help you run away from that lion. You're probably going to run pretty fast. And in that running, you're going to use up quite a lot of those hormones. And hopefully, if you get away from that wild animal, you'll be able to come down, and you'll be able to come down and move back into rest and digest, and therefore be able to digest your food optimally again. Unfortunately, in the way that actually on just the way that we live our lives these days, and the pressures we have on ourselves and on our children and the things that they're feeling, is that we're more in a sort of chronic state of fight or flight. So we haven't got that acute run it all off and then move back into rest and digest. We're in fight or flight in a chronic state, so our digestive systems can't work optimally, so they are working at a sort of lower level, and unfortunately that just means that they need some more support. And there's so many different things that we can do to help with that, and really we're thinking a lot about the vagus nerve, so that communication between the brain and the gut that Indra was talking about earlier.
Thank you, Cori. And with that, I'll give you a top tip for the vagus nerve. Didn't spit it, that's good. So gargling really hard for as long as you can. 30 seconds would be brilliant. Morning and just before you're going to bed. It's really nice. Kids love gargling. The amount of times they laugh at me when I'm gargling on the screen, and when they get to join in as well. But that's a really good one to activate and just switch from fight, flight into rest, digest. So Indra, would you mind putting the next slide up, please? Okay, so let's have a quick recap. GP has dealt with eczema in a straightforward way. They're looking at treating the symptoms, the itching, the bleeding skin, just to ease the distress as well. But hopefully you have a bit of an understanding now how we at the Dr. Indra practice would help your child on a much deeper level using that collaborative care approach. We're casting a wider net than your GP would be. We're learning about your child's life story so that we can understand what's going on in all those different systems in their body as much as possible. We're aiming to improve your child's life to help them reconnect with their joy, to help them understand just how resilient they are, to let them re-engage with the things that make them happy. And Indra, would you like to go a bit deeper with that with the next slide, please?
So as I spoke to you about root causes, we as a sort of medical team, we want to understand all of those connections and look at what the potential root causes are. So there's absolutely nothing wrong with what the GP has given. The corticosteroids and the emollients really do work as long as you're using them correctly at the right time for the kid, at the right, the right amount for the child. But if we can understand the root causes, such as for this kid, we're thinking it's a gut dysbiosis, which is the imbalance of the gut bacteria that we're seeing, and then maybe a parasympathetic or a sympathetic overdrive for this child. We then, as a team, will then decide whether we need to look at what sort of lifestyle interventions we can add in without necessarily doing any testings, and then maybe look at some testing to see if we can either kind of confirm or deny some of these root causes. Because the thing that I think is really important with managing kids or young people is allowing them or educating them about how their body works. Why is it that their body works the way it does? Does it work the way it does because there is a gut imbalance that's been going on for a while? Is it because of how they manage the way that they look at the world around them or their stress response? Because if we can teach them tools at the stage of 11-year-old, they may not take it all in, but I think we plant little seeds as we go along, little ideas. Even with my kids, they may not have listened, oh, mummy, another green vegetable, and all the rest of it. But now they're in university and they're educating their peers. Why are you not eating vegetables? Why are you not doing this? And they're asking me to sort of tell their friends, this is what you should be doing. So as a team, we want to make sure that we are educating this young person and really speaking to them and what they are experiencing. And that's why having someone like Ruth, who really understands young people, can speak to them, can really get them to open up about what is actually underneath everything that's going on. And someone like Cori, me and Cori had a conversation about another patient, and the wealth of information that Cori has about different ways. Because one of the things I get asked a lot about for kids is, well, how are we going to get them to eat it? Seriously, I mean, it's how are we going to get them to eat the greens and all the really good foods? They just want to have burgers and chips and that's it, or nuggets and chips. Why is it that nuggets is always the go-to for all our kids? I have no idea. Do you have a reason for that, Cori?
I mean, it might just be that, our bodies still think, well, they still know that carbohydrate is the preferred energy source. And so if you're tired or feeling a bit low, you will crave those kind of foods. So it's about trying to think, okay, how do we tweak those foods a bit? what I find really important when we're seeing our patients, and especially with kids, is meeting them where they are. So what do they like eating? Let's make a list. What things do you like eating? What things do you not like eating? Okay, so your favorite food is pizza. This 11-year-old girl, she doesn't like any vegetables, but she will eat pizza. Okay, what's our first step going to be? Our first step is that we're going to add some more veg into that tomato sauce, and we're going to try and just get some more nutrients in that way. So sort of one of the best ways to support our gut bacterial balance, which has a big knock-on effect on our immune system, is actually to have a really diverse diet. So really what I'm looking for is to try to support people to have more diversity in their gut, trying actually not to take too many things away and trying to really promote more things. And so, you know, in that tomato sauce, could we add some carrots? Carrots are really easy to add to tomato sauce. Some herbs, which are really great for sort of liver health and antioxidants. So antioxidants very simply are, you've got a cell, you've got free radicals. You might have heard of free radicals. They cause damage to the cell, and you've got antioxidants, and they come up over to the cell, and they heal that cell. They make that cell better. So yeah, herbs, other vegetables. We can even add some protein in there by whizzing up some cannellini beans or something like that, and we can really start to change that gut environment by making very small tweaks. I also think with children, there's something to be said about presenting whole vegetables as well as putting vegetables within things. So, you know, hiding some so that we know they're definitely going to get some of them, but also, you know, this is a vegetable and it is actually delicious and you can prepare it really deliciously. How are we going to do that? How are we going to make you like these vegetables? So a bit of a mix. I think the main thing is to prioritize what is going to make the most benefit. So, you know, really like just a few things at a time. We don't want to overwhelm the child, and we certainly don't want to overwhelm the family. We want to make meal times really enjoyable. So it's about working with them, seeing where they're at, what we can do to really help with that.
Brilliant, thanks, Cori. And from the sort of mindset and mental health side of things, it's making it fun. It doesn't have to be all serious, raking over your past. And I think some kids can be quite worried that that's what sort of a therapy type thing is going to be. It's about engaging with the things that they love. It's about meeting them where they're at. So if a kid doesn't want to talk to me on screen, they can, you know, I've got some kids who play with Zoom and put an avatar up, so I never really see their real face, but they're still interacting with me. I've got some kids who just like to have the head down and draw, and will occasionally do a thumbs up or emojis to let me know how they're getting on. It's okay. And it's about teaching them lots of different tools and techniques so that they've almost got this like invisible tool belt of different things that they can use in different situations. So I might give them some breathing techniques, but actually they're not going to do them in school because it draws too much attention to them. So there's other techniques that we can bring in. So, and then they can layer them up and have a play with them. And it's also, and I think Indra, you alluded to this as well, it's also about allowing the kid to become a detective so that they become more aware of the signals that their mind and body is sending them, that perhaps they're moving out of balance or when they're moving back into balance, so that they learn to listen to that inner wisdom. Indra, over to you again.
So we've talked about food, we've talked about mindset, we've talked about the gut health and how we can utilize food. And we're very much food first. And if you listen to Cori, she's all about diversifying and adding things to the food plan rather than necessarily eliminating things. When we're training in functional medicine, one of the first things that everybody says to do is to elimination food plan. Let's just clear everything. Sometimes that's appropriate, but we feel as a team, especially when we're managing kids, that isn't what we want to give them. We want to really educate them on what's right for their body. And I think through that education, they'll know what they probably can't eat and doesn't really suit them. And it's about working with the child to do that. The other thing that we were also going to look at was sleep. And sometimes through the testing, maybe without testing, we may consider adding a little bit of something like magnesium or other herbs that will help with that whole sleep process. Magnesium, as I'm sure a lot of us are aware, is so deficient in our world, in our soil, everywhere. So a lot of us, and magnesium is involved in so many parts of our processes in our body, and actually it really helps with just that calming effect of getting the patients to getting them to go to sleep. And it's about finding the right kind of supplement to help them when they're going to sleep as well.
So I think we're sort of saying to all of you that what we're doing is very different to an NHS GP. We are actually communicating as a team and looking out for our patients as much as we can, coming at it from lots of different angles, trying to support, moving our patients to better health, whatever that looks like for that patient. And in this case of the young person, relieving their distress, helping their skin heal, and just giving them a better quality of life overall. And I think we're probably at the end of the talking bit. We did go over a little bit.
That's fine. Thank you very much for everybody listening to us. I'm just going to put a link in to the chat. We would love some feedback about our talk today and what you would like to see from us and how we could improve what we're doing. And the reason that this has really come up for us is that Ruth came to me and said, I'm seeing, as she said, I'm seeing loads of kids with behavioral challenges that she is working with, and can we look to support these kids with ADHD on the spectrum with behavioral changes? Can we look to support them as a team? So we're coming up with a child and adolescent pathway for them, where Ruth will be leading it and me and Cori will be giving you the support that child will need going forward. We're really wanting to understand the whole picture of the child. So thank you very much, everybody. I'm going to stop recording and open it up to the floor for some questions. Actually, before I do that, I want our team to just introduce themselves, if possible, and just to say who they are and what they do, because there are a few members of our team here today. So, Sarah, do you want to unmute yourself? Oh, she's not there. Ellie, did you want to unmute yourself?
Hi everyone, so I'm the patient administrator and care coordinator for the practice. Please send us your questions if you've got any after today, if you've got any more thoughts afterwards, we'd be more than happy to try and answer them for you. And if you've ever got anything that you'd like to talk to us about, whether you think that it's something that's actually worth looking at through functional medicine, again, please just book a call with us, send us an email. We're more than happy to help you. But look forward to working with all of you.
Thank you, Ellie. Bobby, did you want to just tell us about your reflection on what we do and what you also do in our team?
Sure. Well, hi, everyone. I'm Bobby. I'm the integrative pharmacist on Indra's team. I'm also an Ayurvedic practitioner and a yoga therapist and mindfulness and meditation. And actually, I did some work which was really probably the most rewarding work I did in the last few years, was actually creating a mindfulness-based yoga therapy course for young children on the spectrum. And they were sort of around the age of sort of 13 to 16. And they did a 10-week course. And the changes in the behavior from just doing something physical, moving, but actually starting to learn what a safe space is. And that was their yoga mat during this period of time. It was just profound to see the change. We did assessments through sort of behavior and how they were responding outside of school. And it was really, really quite a big change. And that was probably been one of the most rewarding things I've done in recent years. So I wanted to share that with you. But in terms of working in the practice, it's an amazing collaborative practice, which I can quite honestly say, hand on heart, you don't see anywhere else, because everybody brings their expertise in and everybody is open to all the expertise that comes along. And I think, as Indra describes symptoms as love letters, it's just so beautiful because from an Ayurvedic perspective, all of these messages are love letters. And when we respond to love letters with love and from the heart, especially for our children, that's where we see them nurture and grow so well. So I hope that we do see you in our collaborative care practice, because I think there is so much for your children to gain from it.
Thank you so much, Bobby. I want to introduce two other practitioners that are here with us today. And if they don't mind, Louise and Liz, just to sort of say why we're connected to you and how you may be supporting, and also reflection on what we've presented today. Liz?
Hi, everyone. So my name's Liz Corcoran. I'm a functional medicine doctor, but I'm also a psychiatrist. I'm excited to be collaborating with Indra, Ruth, and the whole team doing the mental health work with children and young people. I have come on a long journey, just like Indra, having seen and worked within the NHS, but then also have sort of grown in my own training to be able to understand that we need to think about the whole person, that our organs don't function like a bunch of soloists. They make a symphony, they work together. And for myself as a psychiatrist, I had always had a sense of that. And that when we think about helping a young person or even helping an adult, that to do that, we must help put them back together in lots of ways. And when you work as a team around people who are struggling, something very special happens. You can really put your perspective of that person together and then work together as a team to help that person heal. You don't take the credit for it yourself. The person does the work, but you're alongside them, and that's a great honor. So I'm very happy to be a part of the team and helping as and when the guys call on me. Yeah.
Do you have any reflection on how our approach is? Is that the kind of approach that you take with the kids that you?
Well, yes, definitely. And I think that if you try to do anything on your own, often, you're a victim of your own pride, because people need those other perspectives. So it's wonderful, watching as your clinic's grown, Indra, and just seeing how everyone's bringing different aspects of healthcare professional approaches and the way they view the person in that slightly special, different way. So yeah, I really appreciate being able to come and add to that, and also that you guys are thinking about the whole child, not just let's just clear up that rash and off you go, little Johnny. They often, I say often, always, there's always a mental health dynamic, and I think even just being ill itself can be very difficult for the child and the family system. I think we have to give space for that without them being afraid that we are discounting symptoms and just wanting to set them on a path towards lifelong medication. It has its place, but I think we too often use it as a way to silence people's distress or difficulties. So we have to give space for them to be able to feel safe to share those things. And unfortunately, I think that is something which we've lost due to time pressure within conventional settings. So I really appreciate what you are all bringing to this team, and I hope I can be of some service to you guys out there.
Thank you so much, Liz. And I want to introduce Louise. Well, Louise and us have met recently through another colleague of mine, and Louise does breath work, and she has blown my mind as to how the fact that we don't breathe properly affects literally everything. So me and Louise have just done a video together, and we will be putting it on our website about the basics. But Louise, just introduce yourself and tell us, how does breathing affect kids?
Can you hear me okay?
Yeah.
Fantastic. So thank you, everyone. So I'm Louise. I'm a GP for over 20 years, but I went on a mindfulness journey, I think in 2018, but along that journey, I started to snore. So I knew what it was like to function as a non-snorer and then to function once I corrected how I breathed. to function again as a someone who wasn't snoring. But then along that journey, I just so resonate with everything that you've presented tonight, because obviously I'm a GP, I'm still working as a half-time GP, the other time as a breathing practitioner, but you've got to look at the whole picture. And I just love your idea of these love letters. I just think it's when your body's talking to you. But from my perspective with breathing is, we are living in times where we're not necessarily living as we've been biologically programmed to live. So we're not necessarily breathing as we've been biologically programmed to breathe. And then, as you were talking about with the fight-flight system, if we're breathing sort of faster and harder and use mouth breathing and noisy breathing at night, that will drive that fight-flight response. Whereas and that will affect gut, that will affect repair, immune system, because we're not necessarily breathing as well. But we can change how we breathe. We can work on how we breathe when we're awake, and then that improves our 24-hour breathing efficiency. So then it helps us, it develops that rest and digest system, and then we're more likely to sleep well. So that's where I come from it, from my point of view. But I think I definitely see health and well-being as a jigsaw puzzle with many pieces, and different pieces are different for different people.
Thank you so much, Louise. So I'm going to stop recording. Oh, Sarah, you're here. Just quickly say who you are, and then we're going to go on to the questions.
Yeah, sorry, I was just sorting the children out. Busy mum. Yeah, so I'm the patient manager, and I'm also the phlebotomist of the clinic as well.
Thank you, Sarah. Right, everybody, I am going to stop recording.